Once your hands are washed, then you will get your equipment ready and your dressing trolley will have already been cleaned. Ensure that none of your packaging touches your cleaned dressing trolley. Ensure you wash your hands after touching any packaging. When you open the dressing pack, make sure you work in the direction of the dressing pack using 2 hands, ensuring not to contaminate any parts of the sterile field at all. Take your time with this. Then put your equipment out, ensuring that all your equipment has been checked for expiry dates and that all intact. The amount of equipment is per the number of lumens that you have. If you have bloods to take during this, then you would take out equipment for blood taking as well. You can use your bag as forceps, but ensure that you do not touch the bag, only the inner of the bag. In a pincer type movement. Ensure you have the correct gloves size-wise, especially if you are using a stack lock. One pair of sterile gloves is sufficient for a PICC dressing. Make sure when you attach your bag that you attach it close to you so that you're not crossing over your sterile field when getting rid of unclean swabs. You wash your hands and then you get your non-sterile gloves on, ready to remove dressing. Using non-sterile gloves, remove the IV3000, work in the direction of the entrance site, making sure not to touch the key site. At this point, you would also remove if there was a stat lock there or a bio patch. You would wash your hands and then put on your sterile gloves, making sure not to touch the outside of the glove. You can only touch the inner of the glove. So And the other hand helps on the glove. You can touch the sterile part of the glove, helping the other hand on. Then put out a sterile field under the arm, never under the PICC line. You will then clean, breaking the chloroprep and letting the chlorhexidine run down. Using a piece of gauze, you will hold the non-sterile part and you will clean well with the chloroprep at the entrance site for a good 20 seconds, and then clean either in a crosshatch way or a circular motion, ensuring not to bring any dirt into the entrance site. You can see that the secure cath stays in situ. It can be a little pinching for the patient, so be careful when you're moving the line and cleaning. You can clean down the line with the chloroprep, but be very careful not to migrate the line. You will let dry then for 30 seconds and then apply your IV 3000, making sure to cover the entrance site. You can keep the date and time to apply at the end. Make sure your line is nice and straight and will be comfortable for the patient. Only touch the sterile part of the dressing with your sterile gloves. You will then change the bio-nectar using 2 pieces of gauze to ensure that your gloves are sterile at all times. You will then clean the hub of the line with a Clinell wipe, fully opening your Clinell wipe, cleaning for 30 seconds using all 4 corners of your Clinell wipe. And then allowing to dry for 30 seconds. Keeping your hand in position. You then check for drawback. You want to check that you get venous return and that you're in the superior vena cava. 1 to 2 mils of drawback is sufficient. If you're getting no drawback, you can ask the patient to reposition themselves by moving their shoulder slightly or a little cough. Once you have drawback, then you flush your line with posse flush or drawn up sodium chloride. It is a push-pause technique. You want to create some pressure and some agitation in the line nice and quickly. And as you come to the end, about the last 0.2 of a mil, you then get ready to lock the line, having some pressure as you do this. You then finish with a date and time and measurement in centimetres from the entrance site to the end of the bionectar, and record on your trust documentation.